We are so proud of all of our associates throughout the organization and the way in which they have embraced Teach Back. They really are all very committed to making sure that as our patients move from one level of care to the next, that they know exactly what to do to be safe, and Teach Back has been an excellent way to assure that.
In the inpatient setting, our multidisciplinary team uses Teach Back as an evidence-based method to assure that our patients are learning the vital information they're going to need at discharge. Our caregivers and handoffs at the bedside also speak to the patient's willingness and readiness to learn, as well as where they are in the Teach Back education that is vital to their discharge. This Teach Back will continue across the care continuum once they are safely transitioned on.
Teach Back is an effective tool we use here at St. Luke's from the time the patient is admitted all the way through discharge. Our Teach Back tool is used by our nursing staff, by our primary coordinators, and all staff that actually work with the patient. The reason that we use it is to not only help the patient understand and be able to apply the concepts that we're doing, but also to be able to understand if we've done a good job in our teaching. We also use it in our heart failure clinic here. It's really important for us to understand and to be able to work with the patient and to be able to help figure out any barriers that they have to applying concepts to their everyday life by being able to have them tell us what they've understood and what they've been able to achieve and access from their hospital stay. As well, it's used in our home health setting to know and to be able to apply that in reality. Unfortunately, there are times when we do a lot of teaching to our patients, but when they hit home, reality hits the door. And so for them to be able to take those concepts and to be able to apply them to everyday life has been the most effective tool we've had to help keep them out of the hospital and to keep them as safe and healthy in their environment as we can.
At St. Luke's, our mission is to give the health care that we'd like our loved ones to receive. Providing safe transitions in our care for our patients and families is one way that we live that mission. One of the many things that we do here at St. Luke's is Teach Back, and with Teach Back, we incorporate universal health literacy principles with that. Our results have shown great inroads in patients' ability to self-manage. We want to show you now an example of where we've used Teach Back with our discharge instructions. In this example, the nurse has already given the discharge instructions to the patient and is going back to assess the patient's level of understanding. You will also see in this example one of the greatest barriers that we often see with our patients and families, and that is being in a hurry to get out of the hospital and being in a hurry to get home, which can definitely impact their ability to fully understand their instructions, which can lead to a safe transition home.
So Larry, thanks for listening to me talk through all of this stuff. I know you've been anxious to get home and are really looking forward to getting back to your family. Do you mind if we go through these instructions, just a couple points that I want to make sure that you understand, just because they're so important? Would that be okay with you?
That's fine.
Okay. The first thing that I wanted to double check on was your appointments. It's very important, you know, that you go to the appointments that were made for you once you get home. Do you remember on these discharge sheets where you would find those appointments?
Yeah, this one here is for the see the surgeon is March 1st at
Great.
1 o'clock.
Yep, you got it. And I know this was really confusing, but there's a little tricky part about that, and that's with the chest x-ray. Do you remember when the chest x-ray will need to be?
Yeah, the first one's right here, Monday, March 1st.
Great.
At 1 o'clock.
Okay.
And the next one's, well, it'd have to be earlier because the x-ray was supposed to be for Dr. Levitt.
The last thing that I wanted to just double check with you is the medications. The only reason being you gave me kind of a funny look when we were talking about the one that changed. Do you remember what that one was?
Yeah, the aspirin. I'd been taking 325 milligram aspirin every day for some time, and now this says go down to 81 milligrams.
Right. Yeah, it's kind of a tricky deal. The reason that they have decreased the amount of aspirin that you're taking is because you're on that Plavix at home too, and Dr. Levitt doesn't feel that you need the full 325 milligrams of the aspirin. Instead, you can go ahead and take a baby aspirin. And so one more thing I wanted to add that I kind of forgot was why you don't need a prescription for that at all.
You can just buy it at any place.
Right. You can just get it over the counter.
It's really probably a darn good thing that you're pointing out all this to me because, you know, I'm just ready to get out of here. I mean, my wife is the one that's going to look at the papers and make sure that I get the appointments, and she's going to do the cooking, and the salt's not going to be on the table anymore. So, like I said, I just wanted to get out of here.
In conclusion, patient safety is a high priority, and I think these patients pointed out that Teach Back can be a very important intervention in achieving that patient safety. Thank you.